This is Transparency, a podcast by Gender Dysphoria Alliance, hosted by Aaron Kimberly and Aaron Terrell. Each week we'll be joined by people who have personal or professional experience with gender dysphoria and physical transition. We'll also discuss how our trans experiences relate to the concept of gender identity. Join us for a compassionate yet heterodox approach to the question of trans.
So welcome everyone. We've got Michelle here with us today. I've known Michelle for a little while now through GDA. Michelle is a Canadian detransitioner, has a really interesting story to tell, has written a blog post. So you've written your story a little bit for us, Michelle, but we're really excited to have you on the podcast just to have a conversation with you, hear more about your story, and then we'll just see where that takes us. So thank you, and feel free to say anything, any words of introduction that you would like to start with.
Yeah, thank you for having me. I figured maybe I'd just start with like how I started questioning my gender in the first place. And it was 2008. I had just come out of a relationship that wasn't all that great. Was kind of emotionally abusive. He was very controlling. And there was something I had noticed within that 3-year relationship, which is that we did not have sex very often. And so in the back of my mind, there was a part of me that was just like, is that normal? Is that weird? And I eventually found myself on an asexuality forum. And within that forum, I did identify as asexual for like many years after that. But on that forum, there was like a sub forum that was about gender. And a lot of people on the asexuality forum were questioning their gender, identified as, I don't think even non-binary wasn't even a term then, but it was more like genderqueer, or they identified as transgender. And there was sort of, it wasn't specifically for just people who identified as trans. It was just an area to talk about gender in general. And one of the threads one day was asking, how many of you, what is your gender, and how many of you have ever questioned your gender? And I remember writing something like, I'm a woman and I've never thought about it before. And immediately after I submitted posts, there was a voice in the back of my head that said, why not? Why haven't you ever questioned your gender? And that's kind of where it started. And then I guess over the next couple of years, a little while later, there was, I would just start thinking about it pretty much all the time. I was also in a live journal community called BIRLS, so BIRLS, which it was girls who looked like boys, and it was mostly lesbians, but there was a very small percentage of female to male transitioners, and they were documenting their stories. And I was just so fascinated by it. And probably, I think that's one of the reasons that I started looking I was trying to reconnect with the way that I dressed when I was younger. So I grew up a tomboy. And so I went to the store and was like buying men's clothes again. And as I was doing that, I guess it felt like I was getting closer and closer to something that a place that I was more comfortable in. And I guess it made me think more and more, does this mean that I'm not a girl? Because there were just so many people around me that were online that were saying that made them not a girl, or at least in this community, it was either you're transgender or you're a lesbian. And at that time, I didn't think that I was into girls at all, which is kind of weird to think about because, I'm spending all this time looking at girls and being like, oh, I like all these girls. And I certainly wasn't following any communities of boys and looking at pictures of boys all the time. But at any rate, started identifying as genderqueer, and then sometime around the end of 2009, it was around Christmas, actually, there was a point where I just sort of was like, you know what, I think I'm going to transition. And it came almost all at once, like an overnight thing almost. And, a couple of weeks later, I was on a family vacation. I got my hair cut short because in my head, I was like, well, I don't want all of these pictures of the vacation of me looking like a girl, so I might as well do it. I came out to my parents like a couple months after that. And then I attended a support group for gender questioning people in Toronto. And at that support group, there were two facilitators. Both of them were transgender. Both had been transitioned for, I think, decades. And they mentioned one day that they knew of a clinic. They had like an inn with a clinic up the street that was supposed to be trans friendly. And they were looking for transgender patients, one male, one female, that they would be willing to basically prescribe hormones for. And at that time, the only way to get hormones would have been to go through CAMH and go through their waiting list and their whole assessment process. And you have to live as your chosen gender for a certain amount of time. So I saw this as like, oh, I just got really lucky here. I'm able to totally bypass all of that. So I spoke to the facilitator. He wrote my recommendation letter for testosterone and sent me to that clinic. I had to get one other letter from my regular therapist because I was seeing a therapist outside of that for other reasons. And she wrote a letter saying that I was of sound mind to make the decision, and I was on testosterone by October of that year. So less than a year after I came out to myself, basically. I guess after that point, it was just as normal, I guess, as you are. I took pictures of myself and, made those montage videos with like the music in the background being like, oh, this is how I've changed over this many months. And I have audio of my voice changing over the first 10 weeks. And I think my voice is still the same as it was 10 weeks. And around about a year later, I was like, I think it's time to book a top surgery. It wasn't covered by insurance in Ontario at that time, so I paid for it out of pocket. I actually flew down to Florida and had that done in January of 2012. And then I guess after that point, there's so many years to go through. So I'm just like, let me just hit all the highlights really quickly. 2012 and around the end of 2014, I would say my mental health wasn't doing so great, and I moved out of Toronto. I moved in with my family members. And about 2016, I decided that I didn't care if my body was masculinized anymore, and I stopped taking testosterone. I moved back into Toronto probably about a year after that. And that was the time that I met the person that became my best friend. We dated for 2 months and then decided that it didn't work out, but we remained friends, and he ended up moving in with me a few months after that. When I met him, he was sort of going for like a femboy thing, but he was still on estrogen. And then over the next 3 years of us knowing each other, so until last year, both of us had very bad mental health. I was identifying as non-binary throughout that. He identified as a whole bunch of different things over that period of time. I can't even remember when and what decisions he was making, but non-binary, and then identifying as a woman again, and then maybe not so much, and coming back and being like, oh, maybe I'm a guy. And he was very unstable, and so was I. We were both very unstable at that time. And both of us got surgery in those 3 years, and I had the partial hysterectomy, so I still have my ovaries, which I only chose because I wasn't on testosterone anymore. And he had an orchiectomy because he wanted to stop taking T blockers. He was okay with the estrogen, but he thought the T blockers were wrecking his health. To be honest, they were both wrecking his health. And so at the beginning of 2020, he decided he was going to detransition back to a man and started changing his name and his gender back on all of his legal documentation. And so I just sort of sat back and watched that happen. There was a part of me that kept thinking, oh, he's gonna transition back. And I'm actually kind of embarrassed to have thought that at this time, but because he's never wavered in that, and his mental health only got better after he decided. It just completely did like a 180 almost. And then 6 months after that, there was a night where we were speaking, and I was just like, I miss the solidarity that I had with other women. I don't understand why I'm still going. I'm still identifying as non-binary and going on like this. And you know what? I think I'm going to also detransition. And it took me a couple months to tell everyone. My parents knew. So I decided in November of last year. My parents knew by Christmas. I think everyone else knew at the beginning of this year. So in January-ish. And I think that basically gets me to today.
And I think, sorry, go ahead, Aaron.
I was just going to say, when you said around 2009 is when you found the whole online gender discussion via that asexuality board. How old would you say you were at that time?
21.
Okay.
21, 22.
Okay.
And the one group facilitator who wrote the letter for you, what was their qualifications for that? Were the facilitators also counselors, or?
Yeah, they were both therapists. They worked at, I don't know if I can say the name, but they're at a hospital in Toronto.
Okay. They're still there as far as you know?
You know what? They're probably still there, yes. I haven't looked them up in a long time, but anyone who's in Toronto and knows the trans community in Toronto would probably know their names.
So it sounds like, what we would now call like an informed consent clinic. It doesn't sound like there was much in the way of assessment, or was that your experience, that it was just sort of it just reduced all of what they would call sort of barriers of assessment? It sounds like it all happened really quickly for you.
I was probably among the first people that did informed consent in Ontario. Just from being involved in the community at that time, everyone was going through CAMH. There was very, very, very few general practitioners that were willing to prescribe hormones. And this particular clinic was known to be trans friendly, basically, which means, I guess, it does what the activists want them to do, or it was leaning in that direction, basically. So they would have been considered progressive. And I had 3 appointments. So I think the first appointment I had the referral to go there from the therapist that wrote the first letter. And then when I was at the first appointment, I think they found out that I had another therapist. So they were like, oh, you should get another letter from that therapist. And they arranged for blood work. And I think during the second appointment, I would have answered a bunch of questions. I do remember going through some kind of list of like all the risks and so on. And like, they didn't know a lot about the risks at that time. I don't remember ever hearing that there would be vaginal atrophy or uterine atrophy at that time, for example. I did know that there were things like you're more likely to get heart disease or stuff like that. And I don't remember anything about regret being on the list either, but I did that and I signed that. And the third appointment, they were like, okay, we're going to teach you how to inject testosterone now. And I was like, I was actually surprised. I didn't think it was going to be that day. But yeah, that was basically the process, was 3 appointments. There were not really any psychological assessment. And I missed that in in the story, but in 2017, I had a full psychoeducational assessment with like 6 hours of testing over a whole bunch of weeks, with like a full history that the psychologist took and everything. And she gave me all these diagnoses that apparently I didn't know I had. ADHD, autism spectrum disorder. Well, I knew I had depression, but major depressive disorder, social anxiety. I had symptoms, but I didn't meet the full criteria for PTSD, and borderline personality disorder, which I don't think I meet the criteria for anymore. And also like a learning disability, with like sequencing. So by that, she means that we had a test, for example, where she would ask me to define a word, and I would talk around the word before getting to the actual point. And then I would be able to finally be like, okay, this is exactly what I was trying to say. It just took me a little longer to get there. And I was also diagnosed with like a slow processing speed, which is pretty much along the same lines as it kind of takes a little bit longer for me to get to exactly what I need to say, which is one of the reasons I didn't want to do podcasts earlier in the year, is because I feel like I'm so much more articulate when I'm writing something and then speaking. But
I know that. Yeah.
yeah.
I think Aaron and I can both relate to that, which is why our podcast tends to meander, and we both enjoy writing.
Yeah.
But so just so that we're really clear on the timeline, so that diagnosis, that assessment, that detailed assessment you had, and that diagnosis was after you transitioned. Is that correct? Yeah.
It was 7 years after I was prescribed testosterone, and I feel like that should have been done before. Like that should have been part of an informed consent. I should have had all of that knowledge to decide whether or not I was going to transition or not. That was even after I was off testosterone. I stopped taking it in 2016. I had the assessment in 2017. Unfortunately, I had the hysterectomy in 2018. So I think some people are kind of like, well, why didn't you know? But I think one of the reasons that I was in it for so long and took so long to detransition, most detransitioners I talk to are usually around like 4 or 5 years they detransition, and I took 10. And I think one of the reasons is because I was really, really caught up in social justice online. And all of my friends were all caught up in it. So, the moment that you feel like your whole worldview is going to flip on its head, you're risking losing everything in terms of community support.
Yeah, there certainly aren't many, if any, sort of formal community supports for detransition. So I can understand, your need for your peer group.
Exactly, yeah. And I don't have very many friends to start off with. So after I detransitioned, I had some of my friends and family members that contacted me saying, oh, we support you, et cetera, et cetera. And one of those people basically changed his mind after I started talking about how I didn't agree with the affirming approach to trans healthcare anymore. And specifically, it was after I said I opposed the recent bill on conversion therapy that included gender identity. And I wrote a huge thing, basically a Facebook post where I was explaining why I didn't agree with it. And he basically said that I was being transphobic, and I had been transphobic over the past several months or something. And he hadn't said anything, and now he was not going to hold his tongue anymore. And I was like, you know what? Maybe we just shouldn't be friends anymore, because I don't think I want that energy in my life. And after that, we had like a giant fight over private messages, basically. So, and then after that, we stopped speaking. So that was probably the worst of what came from my friends. He wasn't even trans. And from my trans friends, I mostly get silence. They're not really saying anything at all. So I don't feel like I have any friend support. Basically, I just have my one friend that also detransitioned, where we speak pretty much on text every day and phone a couple times a week. So that's pretty much it for that kind of support.
There's a saying in marketing that, where there's one, there's many. So, I mean, it makes complete sense to me that if you had this experience with informed consent, that without any kind of safeguarding measures or assessment or talking things through or differential diagnosis, that there's that potential for errors to be made and for people to be harmed. So it seems very reasonable to me that having the experience that you had, that you would, be throwing out sort of cautionary words of wisdom about that specific model of care. And that doesn't sound transphobic to me, right? That you had this very real experience with a specific philosophy of care. And if it's happened to you, who's to say how many people that's also happened to? It's hard to go back, in hindsight and what ifs, but I mean, what do you think? What do you think would have been helpful for you, in that process that would have helped you, perhaps arrive at the conclusion prior to medicalization that transition wouldn't have been helpful for you?
So, like you said, it's hard to know with with the what ifs. Early last year, so before I actually detransitioned, I wrote something where I was saying, I think that if I had been diagnosed with autism earlier, maybe I wouldn't have transitioned. And it's hard to say if that would be true or not, just because I know so many people that were diagnosed before they identified as transgender. So I might have still gone ahead and tried to transition. What I feel like now is it's not even just the health professionals, it's the whole culture, where everyone is saying and I've talked about this online before, where they're saying that being transgender is an innate property of being a person, like you're born that way. And I just don't agree I don't think it's a born that way thing. I think maybe dysphoria could be a born that way thing or have biological mechanisms to it. But that whole idea of this is who you are, and if you don't transition, then you're going to be miserable forever, I think really set me on that path. So it's hard to say what I would have or wouldn't have done in that culture, basically. In a completely different culture where we are talking about it in a logical way and saying, well, this is a belief you have about yourself, and maybe this is going to lessen the distress that you're feeling, but maybe there's other ways to do it too. Maybe in a situation where that had been offered to me, like some kind of, I guess I wish I had gender exploratory therapy, where people were just asking me, why are you so uncomfortable? Why are you so uncomfortable with being a woman? And not taking, because I'm a man as an answer, because it's not backed by anything. There's no proof to back that you're a man. It's just completely going on in my head, basically. So
what did those two, when you said you had 2 letters from therapists to get the original, even in that kind of like pilot program clinic where they were doing like sort of a early days informed consent thing, what did those notes consist of? Like what kind of therapy was involved to get those? Was it just a case of, you're mentally competent, or was there any kind of assessment that went into getting those letters?
So the letter I got from the therapist that wrote the hormones letter, I was in that support group with him, which was like a 12-week long group where they gave you information. It was all people who mostly hadn't decided whether they were gonna transition or not yet. So they were just providing a whole lot of information on hormones and there was even like one day there was someone giving a PowerPoint presentation and talked about regret rates and was like, oh, the regret rate for surgery is less than 1%. Compare that to regret rate for knee surgery, which is like 40% or whatever. And anyway, in order to get the letter, I had a one-on-one session with him that probably was like less than an hour. And I honestly don't remember what was said in that session. He probably asked questions about, how long have you felt this way? Or, have you thought about this? Have you done any reflecting? I'm not exactly sure. I can't even remember. It was 11 years ago.
Yeah, fair.
And so he wrote that after that one session. The one that I got from my therapist, she had been seeing me probably for a year and a half or 2 years at that time. She had never had a transgender patient before. I was her first one. And so I basically presented the idea to her I said, they want me to get a letter from you saying that I'm basically competent to make this decision of sound mind, etc. And there wasn't really an assessment beyond that. I think she just thought that, oh, all right, that's a good thing to do. So I might as well do that. And that was basically it, I guess.
I want to kind of narrow in on that statistic that you threw out. So that less than 1%. I mean, we hear that all the time. That's the statistic that people throw around, that is less than 1%, and they compare that to rates of regret for other medical procedures like knee surgery, and saying, well, less than 1% is less than the regret for knee surgery. But let's kind of, if I could just read something here. So I've got the WPATH standards of care in front of me here. So on page 8, they talk about that less than 1%. But what they say is that, and I'll just read this part because it's fairly short. So the initial clinical approach largely focused on identifying who was an appropriate candidate for sex reassignment. And then I'll just kind of skip ahead a little bit because they just sort of reference where that came from. And then this approach was extensively evaluated and proved to be highly effective. Satisfaction rate studies ranged from 87% in MTF patients and 97% in FTM patients. Regrets were extremely rare, 1 to 1.5% of MTF patients and less than 1% of FTM patients. So the activists really like to quote that less than 1%, but what they forget to quote is the first part of that paragraph that says that clients were very carefully screened back then. There was an assessment process. I mean, these standards of care were in themselves written in 2012, and this is an affirmative model of care. It's not the informed consent model of care. So they still advocate for thorough assessment and psychotherapy, because they go on to say, often with the help of psychotherapy, some individuals integrate their trans or cross-gender feelings into the gender role they were assigned at birth and do not feel the need to feminize or masculinize their body. So this is very clear. I mean, this is page 8 of the standards of care. And they're being very clear that there was a process by which people were very carefully screened over a period of time. And that's why they were seeing the very low regret rate. And they're saying very clearly that psychotherapy can be helpful for people, not to change. I mean, in conversion therapy laws that are being written now around the world, they say, well, any effort to change someone's gender identity would be considered conversion therapy, despite the fact that the WPATH standards of care are saying, well, psychotherapy is often helpful, not to change it and eliminate it if someone has true, gender dysphoria, but those feelings can be integrated into an identity. So it's not saying, no, you're not trans, or no, you don't have gender dysphoria, but, for example, like a butch lesbian who has gender dysphoria, there are lots of butch lesbians out there who don't identify as trans, have never transitioned, and they've found ways of integrating the gender dysphoria into a butch lesbian identity. So I think that's what that paragraph is sort of speaking to, and how that can be integrated. So it's so frustrating for me that activists are throwing around that, oh, it's less than 1%, so let's throw the door wide open to anyone that wants this and eliminate all psychotherapy and all assessment, we can't be confident that that low regret rate will be the same unless our treatment of care and how we're screening patients would also need to remain the same. So it's so misinformed and quite dishonest to continue to throw around that low regret rate when our system of care has completely changed and we are seeing more transition regret. So I just wanted to really point that out clearly. That statistic is still today, 10 years later, being thrown around, even though advocates are now activists are pushing more and more in the direction of informed consent, and Ontario now is forming a committee with the hope of implementing the informed consent model throughout the province. So what are your thoughts? I mean, I'm kind of guessing what your thoughts are, but what are your thoughts about Ontario kind of taking that move and considering all psychotherapy and assessment to be unnecessary barriers to care?
Well, I did submit a brief, and we'll see if they end up deciding if they want me to participate as a committee witness, in which case I'll get to speak in front of them. But in what I wrote in there is that I basically compared myself to like the canary in the coal mine. And I was just like, listen, this didn't go well for me 10 years ago when this just started. And, it didn't go well for my best friend who went through something similar. I don't think he actually had a whole assessment either, but I can't really speak to his whole process. And the other part of that 1% regret rate is it's a completely different population. We've got, in the last 10 years, it's an explosion of teenage girls who are transitioning and young women that are transitioning. The recent CTV W5 episode mentioned that in Canada, it was 85% of the new referrals are all girls. And I don't think that's the population that was in that regret rate. Really, it's mostly adults, and this is teenagers. And I can't really speak to being a teenage trans person or detransitioner because I wasn't a teenager when I started to question and then eventually transition. But I was a young person, and I was a young person with a developmental disability. So I think I'm comparable to a teenager when I was only 22 when I got on testosterone. But yeah, the regret rate is having that trotted out every single time I try and talk about what happened to me is extremely frustrating. I spoke to someone about it, and he said that he'll care when the detransition rate is at 50%, which I thought was pretty shocking. I was like, really? Well, thanks for that. But yeah, so in terms of Ontario going that direction, I think it scares me. It scares me. I'm afraid for everyone that comes after me. I'm just worried. I'm worried that if that's the direction that we go in, then I think everyone who's critical of this issue thinks that there's going to be a wave of detransitioners in the next 5 years, because around 2016 is when the numbers started exploding. If you look at the graphs, where it's just going up, and then there's like a huge jump in 2015, 2016, and then it's just gone up exponentially from that point. And that same person, when I said, the number of detransitioners is growing, he's like, oh, well, the number of transitioners is growing, of course. But I think it's going to be exponentially more than there were in the past, basically. So the percentage is going up, not necessarily just the numbers. So
yeah, it's the ratio we need to keep our eyes on, right? Not just the numbers, but you're right, absolutely right. And
the demographic of transitioners.
Yeah.
what you're saying is entirely different than the previous populations. Is we're talking about teenage girls, and we're applying those same statistics, saying only 1% regret this. So therefore, a 16-year-old, identifying as trans, that needs to be affirmed and pushed along in a medical direction, because again, only 1%, based on a completely different demographic, different population that those were gleaned. That number was gleaned from, like you were saying, Aaron. Sorry, go on.
Yeah, yeah, because you're right that spike in numbers and that complete flip of the ratio of from mostly males to mostly females came after this WPATH standards of care as well, because this, like I said, this was written in what did I say, 2012. The spike came after that, so a lot has changed since they quoted that statistic of less than 1%. Both the model of care has changed. The demographic of clients presenting to clinics has completely changed, and our whole sort of media environment and the messaging around this has completely changed as well, with a lot more internet, a lot more social media, a lot more online pornography, all these factors, right, that they're now saying are contributing to teenage onset gender dysphoria. So much has changed that it's really irresponsible and reckless for people to continue quoting a statistic based on a completely different apples and oranges situation. And even
Exactly.
if it is only 1%, if there are very clear ways in which we could prevent these things from regret happening, what's the harm in just asking the question, like, what can we implement? Like, ideally it would be zero. I mean, right? And if it's really kind of clear that taking certain steps or just having some kind of safety net around these services at the front end would prevent things from happening, like has happened to you, Michelle, what's the harm in having that conversation? Like, I don't understand why it always gets kind of rubber stamped as that's just transphobic and you're being a bigot and we're not allowed to talk about it. That seems really nonsensical to me.
Yeah, and it reminds me of there was that it's not really a study, but it was like a research article that came out recently from, it was Canadian trans people who were writing about transition regret, in scare quotes, regret. And their argument, I didn't read the whole thing, I just sort of skimmed, but their argument was that trying to prevent detransition is unethical, presumably to trans people. But I don't understand that particular. They said, it's unpredictable, which is true. You can't predict who's going to detransition. I know people who had childhood onset gender dysphoria and they ended up detransitioning. Then people who had it during the adolescence, people who transitioned in their 30s who ended up detransitioning. So it is, they were correct in saying that it's unpredictable. There's no way to tell. And I also think that the former gatekeeping models, where they were basically trying to, decide who's really, quote unquote, really transgender or not, those also weren't working, because people would just they would game the system, basically. There were websites. They were still those websites when I was transitioning up, just being like, this is what you have to say, this is what you have to wear, etc. So those weren't working either.
And that was in 2009 when those kind of like websites that existed to kind of coach people to say the right things and present the right way in order to gain, and those still exist today. Their whole Tumblr blogs devoted to kind of teaching kids what to say, or not just kids, but like teaching people what is the appropriate thing to say if they do have to go to like a gender therapist. If you're over 18, that's not even necessary for most people. You can just go and get hormones or surgery or whatever. But in the US, excuse me, I'm speaking from down under here, but in the US, if you're over 18, you can just go and access. But yeah, but that whole culture of kind of inter-community coaching has existed. Aaron, you were saying even like 20 years ago that that existed. It still exists today, and so the whole notion of the concept that gatekeepers exist, and it's your kind of duty as a trans person to kind of circumvent that process and get what you're after is not only acceptable, but there's sort of like it's admirable that you've overcome the cis gatekeepers to get what you need as a trans person, and that kind of there's like a righteous framing to it all, I've noticed.
Yeah, Sasha, I did that short YouTube video about that recently, about this word gatekeeping and what that means, and she's right that there were problems with the gatekeeping, and we're not advocating necessarily for gatekeeping as it was done in the past, because she pointed out, and she's right that when assessment is just a checklist of things that you go through, it's really easy for the community to pass around, okay, these are the questions they're going to answer or that they're going to ask, and this is how you answer them. And so it's kind of a mockery of the whole assessment process, right, when people are just going to kind of tell you what you want to hear anyway. So I don't know that there's any way around that, and I think that's the limitation of any kind of assessment process. But there's this other concept that you pointed out, Michelle, that this other concept of exploratory psychotherapy, which is very different than just someone with a clipboard checking off a bunch of things on a checklist of, yep, these are the things that we covered, and you answered my question satisfactorily. But it's it would be very different. I mean, exploratory psychotherapy is a relationship. It's not scripted. It's a cooperative effort between therapist and the client. It's not. It would be harder to just sort of to fake that and come to the session as a client with premeditated answers to these questions, right? It's a completely different process of just exploring, like, your feelings and how you developed the identity you did. What were some of the contributing sort of influences or factors? I don't see how that would be harmful, because it's not gatekeeping. It's not a clinician saying, yes, you're trans, or no, you're not trans. Ideally, it's a process that you both walk through together, and ideally you both kind of land on the same conclusions together. So it's much less paternalistic and heavy-handed, and I don't see how that would be harmful to people. Even those that do go on to transition, I don't see how that would be harmful. Like, we've had one of my friends, Kenneth Peary, on our podcast, and he's talked about he had to see a psychiatrist for 2 years prior to transitioning. And then I asked him, was that harmful for you to have to do that for 2 years before starting testosterone? And he said, no, it was helpful, because through the questions and that wasn't assessment. So that wasn't gatekeeping. That was therapy with the psychiatrist for 2 years. And questions were asked that at the time he might have just kind of dismissed and said, well, no, that doesn't apply to me. But 20 years later, he's still using that information that he got from that 2 years with the psychiatrist. Questions were asked to help him think about things in a way that set him up for a more successful transition, to navigate the weirdness of transition and the inevitable hardships and hiccups and weirdness of it that you encounter through life, like how much more complicated it is to date people and all of those things. So he feels that therapy really helped prepare him for the things that he would encounter, and that it was helpful. And so they're eliminating not only the safety net for people that may make a mistake and regret it, but they're also eliminating, I think, a process that sets up a more successful transition from a mental health perspective.
Yeah, I was going to say that I guess the argument from activists about not going through exploratory therapy is that they take the position that transition is urgent and like immediately necessary. It has to happen as soon as possible. And maybe that would be fixed a little bit if the waiting lists in certain places weren't so long. At least then they could, be having therapy while they were waiting to be, I guess, given to like a doctor that could watch them and take care of them over the period of time that they're transitioning. Because I don't know if anyone else that's watching knows, but when you're on testosterone, you have to take blood tests pretty much. I don't know how often you guys do it, but for me, it was like every 3 months at first. So it does require like a constant someone watching you all the time.
That's definitely the language that's being used, that any kind of, this dirty word gatekeeping is associated with something oppressive from a social justice point of view, that people, the way this tends to go is people say that I know who I am, and it's not for anyone else to ever say, no, you're not, who you say you are, and say yes or no to these treatments. So not only do they want it fast, but they see it as a human rights violation for anyone to want to explore, those feelings and the motivations behind it, as if that means, well, you're saying that I'm not who I say I am.
Yeah, that reminds me of like an exchange I had with a trans activist on Twitter where I was saying, when I was talking about how it was more difficult for me to get ADHD medication than it was for me to get hormones. Well, I wouldn't say it was more difficult, but like me coming to my doctor and saying I have ADHD wasn't good enough. I needed to have that full site when I already had the assessment done, but I needed like a letter from the psychologist in order to get on them. I guess it's kind of similar, but it wasn't an informed consent thing. It was, I had a whole assessment that did hours of testing to make sure that I had ADHD before I could get on stimulants. And they're both controlled substances, stimulants and hormones. And when I said that anyway, I said, it was harder for me to get on ADHD medication. And she said, well, hyperactivity isn't a protected characteristic, which I think is kind of says a lot about what the activists are going for, that because gender identity is a protected characteristic in Canada, then they should be able to access immediately and have nobody question them, which I don't think is good healthcare.
Yeah, and what constitutes good healthcare is multifaceted. When I worked for the provincial eating disorders program, there were times where we had clients come to us saying, well, I want treatment at your facility. And there were times based on our clinical judgment where we said no. And it's not because we disagreed that they had an eating disorder. It's not because we disagreed that they could use some help for it. But there were times where people were so emotionally dysregulated at the time that with really inadequate kind of coping tools to manage their emotions, to have dug into the eating disorders work at that time without those coping skills to manage the emotions that would have inevitably come up when you do that kind of depth work, it probably would have destabilized them further and created a crisis, a mental health crisis for those individuals. So there are times where we have to have a certain amount of clinical judgment to say we need to time things in a certain way to ensure best possible outcomes. So it's not as black or white as saying, yes or no. It's sort of like, it's trying to put together an ethical and clinically competent care plan for people. So we would tell those patients, well, go and do some DBT work to work on your emotional regulation and develop skills, to manage your emotions. And then once you feel like you have a good handle on that, and day-to-day life is a little more manageable for you, then we can start to do the eating disorders work, because you'll have that safety net of coping skills to handle whatever emotions come out of the eating disorders work. Were clients sometimes upset to hear no? Absolutely. But it was a safeguarding measure for them to ensure best outcomes. And I think the similar principles apply to trans care, that a no doesn't necessarily mean, well, no, I don't think you are who you say you are. I don't think you have gender dysphoria, and I don't think you would benefit from this treatment. It might just be, you need to do some mental health work beforehand, or whatever that is, or stabilize your physical health beforehand. Like, we need a certain amount of assessment in order to care plan and manage for a successful outcome, even if someone is going to, move on to transition. So it's not as black and white as activists sometimes make it out to be.
Yeah, and I think people should remember that, a no now is not a no forever, sort of thing.
Because if somebody's like comes to you and they're so distressed, they're saying, I'm suicidal, I think I'm going to end things unless I get hormones. Well, if they're in that degree of a crisis, just starting them on hormones in itself isn't going to fix that crisis, because now they have to also navigate, like I said, the weirdness of transition, that it's stressful, having to renegotiate all of your relationships, and it's a major life upheaval, and it can be really stressful. So if somebody is at the point of, I am so dysregulated, I'm in crisis, I don't know that that's really the time to be embarking on this major, complicated life change. Is just adding more stress onto that individual. That doesn't seem like mentally health competent care to me. Not that that was a situation for you, but in your case, now that you have some diagnostic clarity, we know, and we have known for quite some time, that there's a correlation between autism and gender dysphoria, and ADHD and gender dysphoria. So knowing that is a well-documented correlation, and pretty high numbers as well, like, I don't understand why it wouldn't be just part of standard practice to do that, to do some assessment for autism and ADHD as part of the transition process.
Yeah, and I think it's even in the WPATH standards of care, they have like a section that lists a whole bunch of diagnoses that are it's almost like a differential diagnosis section, where it's just like, all these things might interfere with someone's gender dysphoria. Basically, I can't remember where it is, but I know it's in there because I've quoted it before. And I think I had almost every single one that was there. Mm-hmm. And I've had people be like, are you sure you have all these diagnoses? And I'm sure it's not necessarily that I have all of them. I just have symptoms of many. Just so many of them overlap. But yeah, no, I think it should be part of the assessment, should involve looking at specifically developmental disabilities like autism and ADHD. I was going to say that whenever I think about that whole process of someone coming to the doctor and saying, I'll kill myself if you don't give me this particular treatment, it reminds me of something I went through with my friend / roommate when he was living with me. He had other health problems, like physical health problems. He had a lot of head pain, and we were in the emergency room once, and he was basically just having a meltdown because he was in pain and the doctors hadn't done anything. He'd seen doctors so many times, and he told them, he was like, if you don't do a test, I can't remember what test, but like, a CAT scan or something, if you don't do any tests, I'm going to kill myself. And they sent him to the psych ward. And why aren't we doing that same thing with people who present with gender dysphoria, saying, I'm going to kill myself if you don't give me hormones? You don't recommend immediate mental health treatment. It feels like a weird double standard.
There are guidelines. Someone sent me guidelines from, I think they're fairly new. I don't know if it was last year or earlier this year. It was presented at a conference at Dartmouth University, and it was guidelines specifically about the the treatment of gender dysphoria in the context of also having an ASD diagnosis. And their recommendation was that anyone that had an ASD diagnosis presenting to a gender clinic, that there should be an ASD specialist brought in as part of their care whenever possible. So people are thinking about this, but how much it's actually, in practice is kind of yet to be seen.
I was involved for a few years in, I guess, the autism advocacy community, self advocates. So, the distinction is important just because autism advocacy is usually overrun by parents. But this sort of self advocacy movement has kind of grown in the past, I guess, 20, 30 years. And I think part of the reason that it's gotten bigger is because, the diagnosis and the diagnostic criteria got bigger. It used to be Asperger's was like a specific separate diagnosis, and then it became part of the autism spectrum, which has caused a rift, of course, because, there's levels apparently to the diagnostic criteria, level 1, 2, and 3, and what like a level 1 person who might have formerly been known as someone with Asperger's syndrome, what they need is completely different than someone who is non-speaking might need, who is like level 3 and needs constant care. But where I was going with that is that when I was within that community, it was apparent that there were a lot of people that were transgender or were gender questioning. And I think that it would be really interesting to hear from autistic people talking about why they think gender and autism intersect. But at this time, the mainstream movement is very much, it's caught up with that same gender ideology where if you're trans because you're trans and you're born that way. So no one's really looking any deeper into it, I don't think. And I have done that, and I've seen parents also talk about it, but specifically in regards to like sensory differences, for example, autistic people have difficulty with something called proprioceptive sense, the sense of proprioception, which is basically like where your body is in space. So if you move your arm, you might not know exactly where your arm is. And so, for example, for me, where it's not as severe as someone who is like level 3, I might pour a glass and like spill or knock something over when I bump into things. Basically, when I was young, I had bruises all down my thighs because I would just walk into things all the time. And then another one is like interoception, which is basically the feeling of inside of you. And I think that's actually part of why I identified as asexual, was that part of that is that I was not feeling when I was aroused. And then other parts of that, like when you're growing up, a lot of autistic people will wet the bed very, very late into life. And it's because they just don't feel when they have to go. And I wonder if that has something to do with gender, having that disconnection from your body, basically. And I wish that more people in the autistic community would write about that and talk about that in a way that sort of relates, the feeling of gender and gender identity to, I guess, the sensory system and the experience of being an autistic person. But at this time, it feels like if you try and explain it away in any way, then you'll probably get shunned out of the community.
That's a really interesting point, because I feel like we do go like within trans discourse, we talk about a lot of overlap with ASD conditions, but you're basically saying going the opposite direction is like within people who have ASD diagnosis within the autism community to talk about the relationship with gender, like going from a different angle there.
Yeah, and like they do talk about it. They'll talk about that overlap a lot, but it doesn't seem to hit the same sort of depth that they will when they're talking about other aspects of being autistic. Like just based on things that I've read and articles from people who are autistic explaining their own experiences, it doesn't seem to go as deep as, oh, this is why I identified as transgender. It's more it's more social almost, I think. It's more them concentrating on things that are very, very surface rather than trying to find something that's much deeper, like, oh, well, it's because that's how I experience the world. Literally, with like physically, this is how I experience the world. And maybe that's that disconnection from the body and not having that same experience is why we're more likely to identify as trans. Or and I mean, I've read and I think it was Lauren Black that wrote articles about gender dysphoria being like a combination of dissociation and rumination. And I think autism just sort of hits that right on the spot, is that when you're autistic, you're also really likely to become obsessed with things, very specific things, have special interests, and then be just only focused on that for long periods of time. And that's probably part of what happened with me, is that I got introduced to the idea of being transgender and of gender identity, and I was just obsessed with it for years, until that obsession sort of waned around 2015, 2016, where I just didn't care anymore. But by that time, I was so far into social justice culture that I couldn't really just sort of turn around. And also, it's that sunk cost fallacy, where you put so much into it, so might as well keep going, kind of thing.
Especially when your entire community is like your entire social network is in that same milieu. So you're kind of giving up everything all at once. Sorry, go on, Aaron.
I was just going to say that it's not uncommon for people with autism to be at least appear gender nonconforming as well, because if you're not picking up on social cues in the same way, or you just don't care about conforming to those social cues, then people may like have mannerisms or styles of dress or hairstyles or whatever sort of visual cues that don't necessarily match the social conventions for their sex.
Yeah, and I know I took those were true for me, and I took those descriptions of myself as meaning that I was trans rather than meaning that I was autistic. And that's why having the diagnosis it took a little while for it to be totally integrated, but eventually made me think, oh, you know what, maybe this wasn't being trans the whole time. This was me being autistic the whole time. Like when I looked back at my childhood, for example, I would think back and to be like, oh, well, I never fit in. And, I had friends that were girls, but they all seemed to hate me sort of behind my back. I was bullied a lot when I was a child, just for, I guess, being impulsive and just saying things, whatever came to the top of my head without really thinking about it. And even sensory things, like when I was a tomboy growing up, I didn't want to wear dresses, but it was partially almost, it had to do with like sensory things, where I didn't want to wear lace because I didn't like how lace felt against my body, or anything that was more than one fabric almost. Like it had to be the exact same all over my body, instead of something that was, I guess, differing. If it was too tight in one area, I need something right now that's like, right now I'm wearing something that's loose everywhere and not like something tight right around here. Otherwise I'd be hyper focusing on why is it tight right here all the time. And I took all of those things, like, oh, I didn't like girl clothes, and I didn't fit in with everyone. And I looked back on it and went, oh, that's because I'm trans. And then 7 years later, when I got the diagnosis of autism, I was like, actually, maybe that was because I was autistic. And it made more sense than being, I guess, born in the wrong body. So.
And you got the autism diagnosis about a year after you decided to transition. Did you kind of start to get, like, when you decided to transition, like, what was that internal process going on? You said it was around 2016. Were you kind of already like learning about like autism traits and going, wait, maybe that's what's going on for me instead? Or did you kind of unpack the gender stuff and then find out about the autism thing?
Just to correct, I didn't get the diagnosis until 7 years after I was on testosterone.
Okay.
So it was actually a lot longer than that. It was a year after I stopped taking testosterone.
Sorry, that's what I meant. Like you said, around 2016, you decided to stop taking testosterone, and then you said it was a year later that you got the autism diagnosis.
Right? Yeah. And before I got the diagnosis, the reason I went for the diagnosis is because someone suggested that I might have ADHD. And so I wasn't even thinking about autism yet. I was thinking about ADHD. And so I went for that and then got the diagnosis. And I wasn't really thinking about gender stuff anymore at that time. It was almost, it just sort of moved to the back of my head. I didn't care about it anymore. I was more interested in, learning about ADHD traits. That became an obsession for a bunch of months where that's all I was reading, so many books. And it even took probably a few more months before I even started looking into autism as well, because I wasn't quite ready to face that part yet. I was still busy with like the ADHD part. But I wasn't relating it to gender. And I feel like the psychologist kind of did me wrong, because she knew I identified as non-binary and that I had the history of being transgender, but it was never brought up at all in the psychoeducational assessment. Like, it was never questioned. It was never suggested that maybe all of these diagnoses had something to do with my gender. She just kind of glossed over it entirely, didn't mention it at all. And I feel like maybe if she had said something, it would have clicked earlier. So I think that was another experience with like the affirming approach, where they just say, oh, okay, that's what you are, and then not tie anything else into it.
Yeah, keep it all simple and all about gender.
Yeah, what you were saying about just it sounds like there's sort of been a cultural shift or an ideological shift within the ASD community, and there's something similar that's happened in the DSD community as well, where, I mean, some DSD activists are really wanting to separate the concept of trans from intersex conditions, because DSD biology tends to kind of get appropriated and misused and distorted by trans activism about what that actually means, and use it as evidence of like a gender spectrum or a third sex, and that for a lot of people with DSDs, that's quite an offensive, and it's just not true, right? I mean, most DSDs, vast majority of DSDs are sex specific, but that ideology and that culture is creeping into the DSD advocacy groups, and some have full on embrace the idea that as someone with a DSD that they are non-binary or a third sex. So it's these ideologies have really crept into a lot of institutions and communities, and conflating a lot of completely unrelated conditions. I mean, similar to your story, I feel like, I mean, I was diagnosed with a DSD before I adopted a trans identity. So that part is different than what you experienced, because you didn't have that information until after you decided to transition and had been on testosterone for quite some time. But I did have the diagnosis of a DSD, but as I've learned things over the years and unpacked things, I mean, I would say that a lot of my experiences could be better explained by the DSD, not from a trans identity. But I mean, this is how life goes sometimes, right? That we don't always have the information that we most needed at the time to make a sound decision.
Yeah, I'm concerned about it being, the ideology being so much in the culture, not just for the fact that we might be missing other diagnoses, like in my case, but just when I think of how, 10, 20 years ago, if there was a child that was like an effeminate boy, everyone would be like, oh, he's going to grow up to be gay. And now it's because it's the culture now where trans is so mainstream, basically, a lot of people will see an effeminate boy, and then the parents might ask them, are you a boy or a girl? And I think, that's starting to become an influencing in that way, how it's not gone from something that we all accept. It's gone from something that we're all constantly thinking about and almost pushing on other people.
And similar to that assessment process, I mean, there are checklists, assessment checklists. So there's one in Ontario, I think, from like Rainbow Health or something, where there's a checklist of things that they expect people to cover, and they do mention some diagnoses that could be mistaken, or sort of that. What is it? I'm trying to find the word. The differential diagnosis, but they don't really. So they say ask about those things, but they don't really say, well, what do you do? So you've asked the question, but now what? Like, so what do you do if those things exist, right? Because I'm sure there are people who have autism and, the classic gender dysphoria. I mean, those two things probably do simultaneously exist in some cases, but I found it really frustrating to do assessment. Like there's just so little oversight and so little training on how do we really do this meaningfully, so that it's not just a checklist that I'm just checking off. I've asked these questions, so my job is done, right? But how do we think critically about these things that we're asking and the information that we're getting? What different differential diagnoses are there, right? Like what things could be mistaken for gender dysphoria? So they kind of admit that can happen, because otherwise, why would it be on that checklist? But there's no direction about how do we think through that meaningfully when those things do, appear in the yes, I've just, in the affirmative that person has that diagnosis. I was going to say something about the DSD thing too. Oh, just that's not one of the things that they routinely screen for. I mean, some ask questions about it and do a physical exam, but I've heard some say that they don't really, unless there's some sort of obvious anatomical ambiguity that can be seen from a basic physical exam, they don't dig deeper into whether there could be a DSD going on for that person. And yet my DSD wasn't immediately apparent from my external anatomy. It was only discovered because I had internal surgery, and unless I had that internal investigation, my DSD probably never would have been discovered. And I know another guy that his DSD was discovered. He had already been on testosterone. He had already, I think, had the hysterectomy and the mastectomy and everything. And then he went for the bottom surgery, got an infection from the bottom surgery. So they were doing a lot of internal exploration just to locate this infection, and that's when they discovered a DSD. So it seems like there are a number of different things that are getting missed diagnostically by not doing deeper and more meaningful and thoughtful assessment.
Yeah.
And that is interesting, like where you were saying is like, so that differential diagnosis, even if you do come up, it becomes apparent that there is like, also an ASD condition going on, or a DSD, or some kind of thing that's often overlapping with gender dysphoria. So what happens then? So if they say, oh, no, it's actually this, let's go take care of that. It's like the trans activist response to that, or even the mechanisms currently in place, the response to that is going to be, well, that's that's still gatekeeping bigotry. Like that's still you're still denying this person their trans identity, and like so no clinician is actually going to be able to go in that direction of okay, let's explore maybe treating your your ADHD or like what would that even look like? I think that's kind of what you were getting at, Aaron, is like where do they even go from there? It's like so it's written in the WPATH that these things can overlap. But I don't even think, obviously, WPATH is going to go in the direction of okay, let's explore that instead of a trans identification because, everything just funneled into going in the direction of trans. Sidetracked there. Just Sorry, go on, Michelle.
Oh, I was going to say, that again reminds me of something I had an exchange about. When I was talking about how I wish I had known that I had autism before I was given a prescription. And, the response was basically like, oh, well, I'm pretty sure you don't want doctors to like being all paternalistic, being like, oh, well, you can't make that decision. You don't want, your bodily autonomy to be taken away just because you have autism. And I mean, that wasn't the argument that I was trying to make. I was like, I just wanted to know that I had it before I was actually prescribed anything. But I mean, the reality is that, sometimes developmental disabilities do prevent you from making decisions that are the best for you. I'm not necessarily, I don't think necessarily that it should mean that you could never transition, but it should be a factor in it. There's a detrans woman online who has been on Twitter, who's been talking about her efforts to get breast reconstruction covered. And one of the letters that she got back was basically the insurance company was acting as if like, oh, we're worried that you'll change your mind. And why didn't you say that the first time when she got the mastectomy, first of all? And then they also brought up her autism diagnosis to be like, oh, well, this might be one of the reasons that you can't make this decision. Why didn't you say that the first time? It's very bizarre.
It's a really, really sick double standard right there.
Mm-hmm.
Well, I mean, I've heard women who have, like horrible period pains or something, and they know that they don't ever want children, and they've gone to their doctor saying, "Can you just do a hysterectomy? Because I don't, I'm not planning on having children, and this pain is awful." And being told, "Well, no, you can't, because what if you change your mind?" So it is such a double standard, right? That I'm sure if she had gone to her GP saying, "I'm trans, I want a hysterectomy," it would have happened right away.
Well, that's what happened to me. So, and when I talked about that on Twitter, I got a few people responding, women saying, "Oh, it's been such a struggle for me to get a hysterectomy, even though they literally are having health problems because of their uterus." And in my case, I had a completely healthy uterus. That, I mean, I said in that thread, I don't even understand why I went through with it. I have so little memory of what was going on in my mind at that time. I think it was just mental illness. I just sort of was dissociating from everything. My best guess was that I just didn't want to have pap smears or have a period anymore, which I think is such a terrible excuse to get rid of a whole functioning organ. But all these people saying, "Oh, I had already had 2 children and they wouldn't let me have a hysterectomy because what if I might want another one?" And I have 0 kids. I can never have my own kids now. Well, I mean, maybe if I had IVF, but I can't get pregnant. I can't give birth. So why didn't they have that same sort of attitude towards me at any point? It was never, I think they did speak to me about having kids and I was like, "Oh, we'll just adopt." But I didn't know like the realities of how difficult it is to adopt and how difficult it is to even do surrogacy, which is, a controversial subject in itself. But, they never really went through, how difficult it will be to have children if you can't get yourself pregnant. So it's crazy how it'll be so difficult for some people and so easy if you just declare that you're not a woman and they'll give you a whole hysterectomy. And that one was covered by insurance. I think that was part of the reason I went for it, was just like, oh, well, and it made the decision so much easier for me, it made it rather, not so much the decision, but making the impulsive decision to be like, oh, well, then I can just have it done. And if I had to pay for it, I don't think I would have ever had the hysterectomy. So.
And even people that transition and say that they're happy with their transition, it's not uncommon for people to say, but there were still things along the way that I hadn't thought of, that pop up. It's hard to predict all the different variables, and we can't control all those variables. We can't control how other people respond to us. We can't predict a bad surgical outcome. I mean, all of those things happen that are beyond our control, and it's complicated, and it doesn't always work out the way that we expect it's going to work out. People that we think are going to be supportive aren't always, and vice versa. Sometimes people that we think are going to be unsupportive end up being some of our biggest supporters. So it's it's complicated, and just so many variables. And I don't see how it's informed consent if they're not properly informing people, right? Like, if you didn't have the information about your autism diagnosis, for example, and what all the different symptoms of autism are, and how that might have informed your trans identity, how is that informed consent then?
That's what I keep asking myself. It's basically what, even before I ended up choosing to detransition, when I was first thinking, you know what, maybe I wouldn't have transitioned if I had known earlier. That was when the questions started coming up, being like, did I really have informed consent if I wasn't even informed about everything that it could possibly be, and was only, I had a specific pathway in mind for myself, like, this is the treatment that I want. And, it might have been, at that time, I didn't want anything else. And maybe I would have been annoyed if they had recommended therapy instead. But, looking back on it, like, I would have rather been annoyed than have ended up losing my fertility at the end of it. So
what would you say in terms of the impact on you in the here and now? You've mentioned the fertility aspect of it, and just the loss of that ability to have your own children biologically. So what would you say are some of the other ongoing, just the impact on you as a result of having made that decision to transition and then detransition?
So earlier this year, I'm still registered at a fertility clinic right now to potentially do IVF. But I've gone back and forth on whether I want to actually go through with it or not. And maybe that's a good thing, like, I think about, so my experience with the fertility clinic, and I think about that versus how I was able to get access to, like, transition care so quickly. So earlier this year, I went to the fertility clinic because I was very, very, very certain that I wanted kids at that moment in time. And if it was fully funded and I was able to access it right away, I would have done the procedure, like, immediately. And now it's there's a waiting list for funded IVF. And it's not even fully funded. It doesn't cover, like, medications, which still cost thousands of dollars, but it covers sort of just the procedure of removing eggs and freezing them. And even now, we're maybe 6 months later, maybe not even 6 months. And now I'm not sure if I want to do it or not. And I compare that back to with transition, maybe if I was on a wait list, maybe I would have changed my mind. Maybe I would have suddenly been like, I don't know. But anyway, in regards to the impact of being infertile, back when I was first pursuing it, I had a lot of days where I was just crying all the time, thinking about, I'll never give my nieces and nephews cousins, and thinking about, like, I guess, the family aspect of it, and those relationships and feeling like maybe I'm missing out on something that my brother and sister might. My brother doesn't have any kids, but he might. That they've gone forward and it feels like they're moving on with their lives and I'm still behind and maybe we'll never have kids. And it's been tough. But it's also another thing where I'm just sort of maybe it's making me think, maybe a waiting period of time would have been better for me, even with transition. So I'm being forced right now to go through a waiting period, even though I didn't want to. So I wasn't able to make an impulsive decision. And I've realized that I've changed my mind, although I might change my mind again. But maybe the waiting isn't such a bad thing.
How long's the wait list?
When they told me it was 2 years or a year and a half. And even then, like when I go through the process, it's going to be, we're just freezing embryos. It's not actually someone will be pregnant and then I'll have a baby in 9 months. It'll be just freezing embryos so that I have the possibility in the future. But one of the reasons I was rethinking it was that in the past few months, I was reading what other people or other detransitioners have been sort of looking into. One of them was looking into I think it was the East Germany doping scandal, where they had, there was a government funded program to give, I think it was testosterone, but it was androgens by any chance, to female athletes who then had health problems for basically the rest of their lives. And a lot of them had deformed children. So children with like clubbed feet or other birth deformities. And there was a part of me that just sort of recoiled and was like, what if I go through IVF just to have a child that has a disability because of something that I did to my own body? And so that scared me. So that was part of the reason I started to rethink it.
Jeez. I hadn't even thought about that part. What supports would you like to see created for those that do regret transition?
Support groups run by actual health professionals would be a good start. The thing I'm very frustrated about for myself is that I was put through all of those things. I was put through on the path of transition, and then at the end of it, chose to detransition. And those same health professionals that had all of the information that were supposed to be trans friendly and so on have nothing about detransition. I don't think any of the professionals I work with are ever gonna admit that, they were part of it. They're not gonna say, I'm sorry if they're doing that. They're admitting that they were liable for it. So I don't think I'm ever gonna get that from them. But I feel like that community support is the big thing, just because so many of them lose it. But in terms of other supports, within the bill that's coming up in Ontario, I've suggested that, they're talking about trying to get insurance to cover transition-related procedures that have never been covered before. So like electrolysis, and they've said chest contouring, maybe facial feminization surgery, etc. And I proposed in that brief that I sent that they cover detransition procedures as well. They cover breast reconstruction. They cover, testicular prostheses if you've had an orchiectomy. The main part is that I feel like healthcare professionals they're not prepared. They're not prepared to deal with detransitioners at all. And I guess another the frustrating part about it is after detransitioning and sort of coming back with a completely different worldview, you're faced with sort of all these people that haven't come around to your way of thinking. And I know it's harsh to refer to, that being part of that mainstream narrative and the activism that's being pushed. It's harsh to refer to it as like a cult, but it feels like you've escaped a cult, but the entire world still sides with the cult. Or maybe you could refer it to like an abusive relationship. It's like coming out of an abusive relationship and no one will admit that you were abused. So it's really even though I feel like, healthcare professionals do have their place in it, where they need to start figuring out how to help detransitioners. What I'm really hopeful for is that, more of larger society actually recognizes that they're, detransitioners don't necessarily, we had our own part to play in it. We're responsible for some of what we went through, but that idea that we are the sole, that we have to take sole responsibility for the choices that we made, as if no one else was involved, as if the culture wasn't involved, that as if it was impossible that we were influenced at all. Once they start accepting that, it's not just me that made that decision, it was other people who, made the decision to prescribe me testosterone. It was people who made the decision to do surgery on me. It was all of the people I spoke to who told me that not feeling like you belong means that you're trans, when it could just have meant that I was autistic. Or, social media culture is it's everything. It's not just, I didn't make the decision in a vacuum, basically. So it would be helpful, I think, to detransitioners if people would stop saying, oh, you made the choice, you did it, you're the only person, you're not a helpless victim, blah, blah, blah. And I don't think I was a helpless victim, but it would be nice if at least people just admitted that there was influence involved at all. So.
And if there were people that were unhappy, or unhappy is an understatement, but if people were harmed by any other clinical system, whatever that was, whether it's a mental health system or a medical health system, if people were saying, well, I think the system can be improved, right, to reduce the harm that it's doing, I can't imagine a bunch of people with diabetes saying you're anti-diabetic because you're calling out, a harm of a particular, process or system as part of the care. It's a strange phenomenon that we're not allowed to kind of question or push back on the system of care without being labeled transphobic. It is very weird. And, and we're starting to see data now from recent detrans studies, like Dr. Littman's, I think hers is the most recent one. And I mean, the stats seem pretty clear from multiple studies that the majority of people who detransition are same-sex attracted, and a lot of them same-sex attracted females. And yet I've known gay female detransitioners who have tried taking detrans resources to LGBT resource centers and being told, no, we won't have that on our shelves because that's transphobic. So I feel like the whole LGBT system, for any gay or lesbian person that's been harmed by this system, when the entire LGBT community is full steam ahead with the gender ideology, it must be especially marginalizing when your own community is, alienating you and calling you transphobic and erasing your experience. I feel like the LGBT community has really failed a lot of gay and lesbian people.
Yeah. And that's something I've thought of in terms of the fact that I'd like to try dating women now, just because I've never had satisfying experiences with men. But when I look forward to it, there's just a part of me that's just like, I'm so concerned that the majority of people that I try and date are probably going to sort of have that same narrative where they think I'm transphobic, essentially, despite the fact that I was trans for 10 years. I was going to say, in terms of people trying to bring detrans resources to like LGBT centers and having them taken away, or I know one person who brought them there and they agreed to put the resources out, and then she came back and they were gone, basically. But it's weird. It's almost like they think that, maybe not think it, but maybe there's a part of them that wonders, if we talk more about detransitioners, then more people might detransition, and maybe they're afraid of that a little bit. I've always made sort of the comparison, like, if you think that I could have been, because I lived with someone who detransitioned, if you think that I could have been influenced to detransition, then why don't you think I could have been influenced to transition in the first place?
And the cult parallels are very strong there in that, or the religion in general parallels, because it's like, if you're among the fold, like that's good. It's good to be among the fold. It's good to be trans. It's good to be a part of this belief system. And then if you extricate yourself from that because it didn't work for you, or for whatever reason you no longer believe it, then that's seen as you are anti whatever that is. So like if you are of a certain faith and then become an atheist, the understanding within those still in the faith is that you hate God, right? That you are that you've been influenced by people who hate God. Now you also hate God, and the same kind of mind frame seems to be applying to the whole detransition. People who detransition is like that same kind of concept of this person has been influenced by a transphobic world to now be transphobic as well. So it's just these weird cultural influences that are all kind of converging simultaneously, where you've got a medical establishment that's working in concert with this kind of religious mind frame, and then you have this notion that it's like it's so crazy that children that trans is glamorized and glorified, and then if once you've traveled down that path of transitioning and then realize, no, this wasn't for you, it's like, oh well, you were just wrong. You did this to yourself. You thought you were trans when you weren't, when really you're existing in this culture that tells you that trans is good, trans is pure, trans is what you want to be. Anyone who isn't is either uncool or a bigot. It's like everything is just pushed in this direction that trans is good, and then if you again detransition or whatever, kind of. I'm losing my train of thought just because it's like you've got two systems going on here, where it's a medical condition that has to be treated, whereas it's also a religious movement simultaneously, and it's difficult to kind of look at each one individually, but they're also completely contradictory simultaneously. I'm not sure if any of that made sense, but
yeah, it's kind of unavoidable to draw some of the religious parallels with the system, right? And I would say that some of the markers of a healthy spiritual community versus a more, I'll try not to use the word cult, though there's lots of parallels, but let's say a healthy spiritual community versus an unhealthy spiritual community. I mean, I would say the markers of a healthy spiritual community are ones where you're allowed to experience doubt, and you're allowed to ask questions, and you're allowed to disagree and work through those disagreements. And when a community becomes such that that you're not allowed to do those things, it is cult-like. And I would say that's exactly what's happened with this belief system around what gender and trans is we're not allowed to question it. We're not allowed to disagree. We're not allowed to think critically about it, and without being kind of labeled a heretic and kicked out of the community.
Yeah. There's a very, very long essay at newthoughtcrime.com where it's written by, she either detransitioned or she's a desister, I can't remember, but she wrote a very long essay about Robert J. Lifton's 8 criteria for thought reform, and goes into those in detail, and then talks about how those things sort of play out in the trans community. And those criteria are things like loaded language. So it's the redefining of words that everyone knows a definition for, but within your community, those words mean something different. There's one criterion called mystical manipulation, where the people who are, there's no one in charge in the trans community really, but there are people who I think are considered bigger authorities than others. But within the narrative that you're given, you're almost reframing your past experiences to fit that narrative, which I think a lot of people who are just starting to question whether or not they're trans, they have the narrative, and then they're just fitting all of their experiences into that narrative, being like, oh, well, that explains it, that explains it, that explains it. And within like a spiritual cult, it's more it reframes coincidences that makes it seem like you were meant to be there. You meant to find that group and then serve a higher purpose, sort of thing. And then within the trans community, the parallel might be, all of these things that you've experienced in your life are reasons that, you must be trans and you must transition, basically. And then just sort of other things like that. But it's that whole, you can't ask questions. If you're asking questions, it's coming from like a lower place. And then doubt is coming from a lower place. And anyway, that essay was something that I read within days of deciding to detransition, where it's very long. So I was sitting up at like 4 a.m. reading this essay, just being like, holy shit, this explains everything that I've been through over the past 10 years and why it's just outlining something that I should have been able to see, but I couldn't see until someone else pointed it all out to me.
Say James Lifton is the author?
Robert J. Lifton is the person who wrote, he came up with the criteria for thought reform. The author of that essay that specifically, and she didn't call it a cult either. She said that she used the phrase unhealthy relationship dynamics or unhealthy group dynamics, which makes more sense. And I think she's also said, the trans community doesn't really qualify as a cult because there's no leader. It's just more of the whole group thing. But there are people in the community that are sort of made to be, more credible than others. And I think if you're in like a social justice place, there is a push to have trans women be considered, they have to be centered at all times. They have to be the authorities. So they are considered to have more credibility within the trans community than trans men. And I know you guys have talked about that as well, where trans men are basically being pushed aside in favor of trans women speaking for the whole trans community. So she goes into that as well. And it was something that I had definitely experienced when I was like basically still on Tumblr, for example. There's almost a fear of angering trans women, basically. And it puts you in a position where you can't really talk about your own experiences as someone who's female, basically, because I was told, so basically I was told that I had never experienced misogyny because I was a man, basically. They were like, oh, well, you never experienced misogyny in your life. But, trans women who grew up as boys and then transitioned as like 30-year-olds, everything that they had experienced, it must have been misogyny. It was because they were women the whole time. And I don't know, a lot of the ideology just doesn't make sense in that way, because, it's not like all of the people that acted sexist towards me when I was still presenting as a woman, they didn't all know that I was secretly a man. It was clearly misogyny. So stuff like that, where they controlled the narrative a lot.
It's like what you were saying with that essay, the concept of just reframing words, like words that we all know, concepts we all understand, and kind of just like turning them on their head, and it only makes sense in that group. When you were saying that, I was just thinking about how Helen Joyce and Grace Lavery have just agreed to have a debate, which is blowing my mind. But if you think about it, because Grace Lavery lives in this world where terms are defined like you just explained. So it's like, how do you have a conversation, when between people who are operating on the original understanding, or the kind of based in reality understanding of what misogyny is and what male and female are, with somebody who's operating on these inter-community completely repurposing of these terms. So it kind of adds to the whole insular nature of the group when you're operating on completely different definitions than the external world. And so, when you're trying to have a conversation between people who are not sharing definitions, we'll see how that goes.
Well, thanks so much. I'm just looking at the time, but thank you so much for agreeing to have this conversation with you. It's been great to get to know you a little bit better and hear more of your story. I followed the things that you've written on your own blog, and you're obviously thinking about these things very deeply. And so I think you have a lot of wisdom to share. So I appreciate you coming on and talking to us about it a little bit.
Thank you. I appreciate you guys bringing me on as well.
Thanks for joining us for this episode of the Transparency Podcast. If you enjoy our content, please help out our algorithm by hitting like or subscribe. If you'd like to make a donation, follow the link to our PayPal account. On behalf of the Gender Dysphoria Alliance, thanks for your support.